Hi, I'm Dr. Therese House with Healthy Choice Family Chiropractic, and tonight we'll be bringing you our body signals workshop focusing on asthma and allergies. So first, I just want to recognize you for making your health a priority tonight and really listening to this webinar. Now, tonight we're going to talk about allergies, asthma, and eczema. But to really understand these issues, we first need to talk about our immune system and how our immune system develops. Now, I will definitely bring it full circle, but that is where these issues really start. The atopic syndromes that we're going to be unpacking here are the most common that we see here in the office. So allergies, asthma, and eczema. Those pretty much cover a very broad spectrum. We cannot fully unpack each of these concepts here tonight. That's not my objective. Instead, we're going to give you a walkaway knowledge so you can know what you should be doing and what is the root cause of all this stuff and what we can be doing to make some big changes. Now, to take us back one step further, we want to start with the body signals description and concept to begin with. So, what is it and where does that terminology come from? Body signals is what we call symptoms, and that is because we acknowledge that the body is innately intelligent. So the body signals or symptoms is one of the ways that your body communicates with you. So we should respect it and listen to our symptoms. With that being said, symptoms are body signals, and they are the underlying sign that there is a bigger problem. They are not the problem in itself. If you have a headache, you take an aspirin or a drug to make that headache go away. But why did you have the headache is a better question. It wasn't an aspirin deficiency. If we look at how people are treating their health today, they are actually treating their health, or are they managing their symptoms? What we are seeing is a culture of pharmaceutical use and a culture of treating their symptoms and managing their symptoms. And frankly, that's not good enough. Look at the trajectory with our health. It's continuing to decline. That's what shows us it's not good enough. So when looking at this body signals graphic, I like to use an iceberg. Because when you typically see an iceberg, you just see what's on the surface, which is a small comparison to the 90% that's below the surface. This is the perfect metaphor for symptomatology. Because if you look at this, you would recognize that, you'd see the surface and you'd be like, oh my gosh, that looks like a huge iceberg. But you wouldn't be aware of what's going on underneath. If we were to approach it from a medical perspective, we would cleave off the top of it and call it successfully treated because we wouldn't see it anymore. Then if that iceberg came back in 90 days or so, they would look at it and say, oh, that iceberg again. But what would happen underneath the surface and what would have happened over the last 90 days? It would have gotten bigger too. So this is what happens when we treat symptoms until we can't see the symptoms anymore. While the problem can get bigger and bigger over time. And typically this means that we are drugging away our symptoms as the problem gets bigger. I would like to teach you a different way. I like to look at this and our wellness illness continuum. 0 is neutral, and that's going to be right in your center. And then on the far right-hand side is perfect, optimal health, and on the left-hand side is death. All of us fall on this continuum somewhere, and there is no stasis. You have to understand that. You're either moving towards health and getting healthier, or you're moving away from health and getting sicker. What we do on this office is we assess where you fall on this continuum and give you strategies and recommendations to move everyone in the direction towards the right and toward improved health and wellness. If you listen to symptoms and learn to read body, your symptoms will tell you about your trajectory and about your philosophy. Now understand that when your symptoms go up, your inflammation went up. And when your symptoms went down, your inflammation went down. So when we start to speak body and understand that when my symptoms went up, my inflammation went up, and we look at what did I do recently? What behaviors did I do that increased the inflammation? Then you are becoming fluent in body. And conversely, when symptoms go down and you understand that inflammation went down, you can look at it and be like, okay, what did I do? What strategies did I use that helped me drive my inflammation down? Now we are going to talk more about these strategies and behaviors and how they can relate to allergies and asthma in just a little bit. So let's talk immune system. First, What is our immune system's purpose? So your immune system works intimately with your nervous system to essentially help you relate to your internal and external environment. There's a complex symphony that is going on all the time that's protecting us and helping us adapt readily and appropriately to our shifts and changes. So you can think of it like your immune system is your body's armed forces. So what do we have in the armed forces? We have the Army, the Marines, the Air Force, the Navy, the Coast Guard. So we have these huge bodies of specialists that operate on different levels to protect us and help people in need. What are the armed forces, or what the armed forces does for the US is similar to what our immune system does for us too. Your nervous system acts as a communication system for all of us. So you can't separate your nervous system and your immune system. They work intimately together. So its job is to help protect you and help you relate to your environment. That's your immune system's job. So how does it work? Essentially, your body is always on alert for invaders. If there is something inside your body that's not supposed to be there, your body has a whole cascade of chemical and neurological responses to that. Usually it works along beautifully, and you don't even have any idea that it's actually happening. Whether it's fighting off a bacterial infection or a viral infection, or just responding appropriately to pet dander, pollen, or a spider bite, it's all responding to our environment. It's even fighting off cancer cells. Did you know that at any given moment, or actually at all given moments, that you are fighting and identifying cancer cells? That's your immune system. You have a magnificent system that is totally subconscious. And most of the time, you have no idea when it is at war. That's when real harmony is with your immune system and your environment. So that's essentially how it works. So next, let's look at how your immune system develops. You are going to understand the immune system a little bit better if I use some real developmental issues. So with the next slide, sometimes people think, well, I blew it. I blew it with myself and I blew it with my kids. My immune system is sunk. I don't want you to think that. But if I don't teach you this, then I'm not doing my job and I'm not doing what we set out to do here tonight. When most people think about prevention, they are not really talking about prevention. When someone is talking about a colonoscopy or a breast exam, is that really prevention or is it early detection? It's early detection, which leads to what? Early intervention, right? So cutting skin moles off is not prevention. It's early detection and early intervention. Prevention would be wearing sunscreen, long white shirts, wide-brimmed hats, and staying out of the sun from 11 to 2. Now that's prevention. So let's teach you how magnificent you are and how your body has been designed through the eons and continues to develop this immune system and uses it as a legacy to pass on from generation to generation as our immune system gets smarter and even as mothers continue to pass it on to their children. So natural development. So how is the immune system supposed to naturally develop? We are born genetically and pre-programmed with a lot of our immune system intact. But then there is a process of development with our immune system that is a lot like training those armed forces. So you take a kid right out of high school and you throw him or her in boot camp. And what do they do first? Well, they run. They get into physical training so they can become physically equipped. Then they go into combat training with hand-to-hand combat, then progress to using knives, rifles, machine guns, and bigger tools. It's all a training process. And as you become more and more specialized, could you imagine, I mean, really, if they took a kid out of high school and they just put him on the front lines and bypassed all that training? This is what we're doing with our children today. And I'll help you understand what I mean by this. I mean, this will take just a couple minutes, so bear with me, though. So here's a natural boot camp that we go through as babies, starting with a vaginal delivery. Did you know that when a child is delivered, well, this may sound disgusting, but essentially what happens is when the baby is delivered, the child is exposed to the mother's natural, normal flora. Guess where a lot of your normal flora lives? In the reproductive tract and digestive tract. So the mother will actually expose her child to normal flora from the reproductive tract as the baby comes through the birth canal. It is part of the natural exposure that builds the normal gut flora in that baby's gut, which, by the way, that normal gut flora makes up over 80% of our immune system. So your normal flora is your friendly bacteria or flora that is inside all of your mucosal linings, your digestive tract and reproductive tract. Anything that is exposed to the outside world, including your digestive tract, has that flora. Because believe it or not, your digestive tract is exposed to the outside world. For example, if I took a marker and swallowed it, not saying you should or ever would do that, then whatever is on the marker is now exposed to my gut lining. So your gut lining is lined with friendly bacteria. You have more bacteria in your gut than you have cells in your body. Over 150 trillion friendly bacteria that live in your gut and are a large part of your immune system. Like we just said, that 80%. And that all starts with that natural vaginal delivery. Then we go from that to breastfeeding. Most of the constituents of breast milk, beyond just nutrition and energy, are the immune components. There is a massive body of research that has come out to let us know just how magnificent this system is. I mean, did you know that a woman can communicate with her child through the nipple as to what the child needs to have the best response in regards to their immune system? So the child will communicate to the mother, and the mom then will change her breast milk on a day-to-day basis to meet the needs of that child, both nutritionally and in regards to the immune system. How brilliant is that? But unfortunately, instead of 1 to 2 years of breastfeeding, the typical child that we see today is breastfed for a few weeks or maybe a couple months at best. So we're missing out on so much of this development. Now, childhood illnesses. So a child will go through this regular process of exposure. And if you've ever been around little ones, then you can see that they frequently get runny noses or goopy eyes. This was by design. You see, this is the boot camp and basic training of the immune system. The design of the body is to take this baby while in a safe environment and expose it in a very limited way, all of which stimulates the immune system and teaches it to respond appropriately and readily to anything that is getting into the body. So what's the body to do to build the system? Well, let's just watch a baby. If we put that baby on the ground and there's something in front of that baby on the ground, what does the baby tend to do? Grab that object and stick it right in their mouth. So why is this? Well, the baby's body innately knows it needs to build an immune response. So the baby puts things in her mouth as a way to get the bacteria that was on the item into their digestive tract, to use that good bacteria that lives in there to build that response. Also, when a baby is cutting teeth, it's another portal of entry, this time to the baby's blood supply, to also build that immune response. So it's training the immune system to respond. So what happens if the kid gets feverish or mucusy? So what do you need to do? Well, what's the purpose of that fever? Our body has figured out that it can heat up and kill off the bacteria, and the fever is part of that natural immune response. So what do we do when a child even has a fever, or if we have a fever? Well, according to the CDC, they rate a fever up to 102.9 degrees Fahrenheit as a low-grade fever. 103 to 104.9 is a moderate fever, and 105 and above is a high fever. A high fever is a high fever, and that is when we definitely need to do something about it. The point I'm trying to make, though, is that there is a real intelligence running this body, and it really knows what it is doing. Now, there is a time for intervention, absolutely, but is it really at the rate that we're doing it now? So what do we see in unnatural development? Well, first, C-sections. Is it absolutely necessary to have a C-section at times? Absolutely. But in over 31% of the births in 2016, I don't think so. Formula. So with a lot of kids, we are skipping breastfeeding altogether. And I think this is really reaching a crisis level. But fortunately, we are recently seeing a resurgence of breastfeeding. Now, this is one of the most important things a mom can ever do for her baby. And it is almost a full-time job in itself, so it deserves all the credit in the world. Now, interference in medication. They are running so medication is running interference in the systems that we are designed to help the child develop their immune system, and we're interfering with it. Whether it's an antibiotic or trying to bring down a fever, we are interfering in the child's training process to build an immune system. I just read some research where there's a huge correlation in a child developing asthma or allergies if they have had an antibiotic and it's under the age of 1 year old. Now, there are definitely times when medication is needed and when antibiotics are needed, but really at what rate? And next is the hygiene hypothesis. Now, understand that there is an interaction between the host and our genetics and the environment. So basically, there's an interaction between our genetics and the environment, which we could also look at as our lifestyle choices. What research is showing is that the genetic component is not as large as once thought, and that this is because the rates of these atopic disorders are going through the roof and our genome is not changing. So what we are understanding now is that it is the lifestyle and behavioral choices that we are making that is playing the biggest role. What we are seeing now is that there has become a culture of sterilization in our environment. How many people are constantly reaching for the Purell or other sanitizers to sterilize our environment? It happens so much that now this next generation sees Purell as part of their immune system. We are raising kids in such a sterile environment that they are not developing their immune system. And now they are walking around with these weakened immune systems, and that's causing them to become hypersensitive. And we'll talk about how that relates to allergies in just a few. And they know this is true because kids who are raised on farms statistically have less allergies because they are around animals and dirt all the time, which helps their immune system to be trained properly. Also, kids who are raised in a multi-child household statistically have less allergies and asthma because with multiple kids, they are also exposing each other to things all the time, which allows their immune system to continue to develop more. Now, I see all of these atopic disorders as behavioral problems. Have you ever heard of the expression, like, your stomach is acting up? Or if you look at a behavioral problem with a kid, is it ever one thing that is causing it? No, it's a lot of elements that all come together and end up creating this behavioral problem. It's always multifaceted. It's the same thing here when it comes to allergies, asthma, and eczema. And any of these atopic issues. It's all a behavioral issue. What's happening here is your immune system is misbehaving essentially and is hypersensitive and misbehaving in its responses. Essentially, you can think of it all like a large glass of water. We all have a certain intolerance level, just like the glass has a water line on it, which you can see right here, right? That's where that glass's water line is. The water can be at different levels, but the glass can only hold so much before the water is going to spill over. Our body and our immune system works in the same way. Whether your glass is at your preloaded state for your immune system, then what happens is we walk into the room where there is a dog or pollen in the sky or under our bed to dust and the cup spills over. This is essentially the response that we're seeing in people. We're seeing with people because of these elements such as dust mites, dander, pollen. They can all be seen as to the body as toxins. And they are all stimulants to create a response from the immune system. The question is it an appropriate response? If you start with an empty cup, then you walk into any of these situations, you'll have no problem. Right? The pollen's flying and it doesn't matter. You still have an immune response, especially at a cellular level, but it's at a subclinical level. There is no clinical response, meaning you show no symptoms. So the question you should ask yourself is, how do I become this empty cup so that I have a greater tolerance? So what are some of these stressors? So basically, what causes your cup to fill up? You think of stressors, you think of toxins when when we talk about the air or air pollution, or cigarette smoke is a big one. Now that's definitely an example of a toxin. Allergens, we talk about hay fever and pollen. Those are the people who are coming in with those seasonal allergies where, they come into the office and they're getting the watery, itchy eyes and the runny nose. And they're being like, Doc, the pollen. But if it was just the pollen that was the sole cause for the allergy, then we would all have the allergies. The real question is, why is the pollen causing you to spill over? Now for dietary. Well, for most people, we unfortunately end up having a very pro-inflammatory diet. Things like white sugar, white flour, the highly processed foods, and high carbohydrate diet. Also dairy. Dairy is a big mucus builder and increases inflammation in our body. And we'll talk about this a little more towards the end when we're talking about diet and inflammation. But this is one of those things that causes that cup to fill up. Then there is a neurological component. And that is something I want to touch base with you tonight about how interference can be lowering the threshold your body can handle and causing your cup to run over quicker. So for Chiropractic 101, and to understand how your nervous system works in short, the brain is constantly communicating with all of the organ systems, and tissue in your body. And all that communication happens across the spinal cord in your nervous system. The body tells the brain what it needs, and the brain tells the body what to do. It's a two-way communication avenue. When that communication is flowing optimally, and there's two-way communication without any interference, you respond readily and appropriately to your environment, and you express health. That spinal cord, though, is protected by the spinal column, which is a series of bones stacked on top of each other. So 24 freely movable vertebrae that form a suit of armor to protect your spinal cord. We know the brain is the most important organ in the body, and we know that because it is encased in bone. While that spinal column protects the spinal cord, which is simply a continuation of the brain. It is just not a solid piece of bone, right? Like we talked about, it's 24 freely movable vertebrae, and there are discs that are in between those 24 vertebrae. And those discs act as spacers to allow for holes so the nerves can exit the spinal cord. So in order for these nerves to be nice, big, and open, and have these open spaces, those discs need to be healthy. And in order for those discs to be healthy, the spinal curves need to be healthy. So your discs are not shock absorbers in the spine. There are curves in the spine that act as shock absorbers. The spine from the front should be straight up and down like you're seeing here in the picture. And we have this cool set of curvatures that we can see from the side that spring and take forces from the spine, not the disc. So as long as your spine has those healthy curves and it's straight from the front, then there can be that free flow of information that helps to keep you healthy. Now in life though, really we have traumas and we have bad habits. When the bones in your spine get jarred out of their correct alignment, either by traumas or bad habits, it puts stress on those discs, which creates soft tissue damage, just like if you sprain your ankle. That soft tissue swells, and then it'll crowd that nerve and put pressure on those delicate nerve fibers that are trying to leave the joint at that level, and it causes a change in the information that keeps you healthy and that helps you regulate all the systems that keep you healthy, including your immune system. Now, when a subluxation occurs, the joint gets jarred out of the alignment and the soft tissue gets damaged. That creates swelling. This swelling creates nerve pressure that creates spasm because your body is smart and your muscles try and splint the joint. And that muscle spasm causes joint fixation. And that fixation creates breakdown and degeneration. And then you have that nerve irritation. The way that your body responds to any irritation or stress is to produce stress hormones, such as cortisol and catecholamines like epinephrine and norepinephrine. And one thing stress hormones do is they alter your immune system, or they downregulate your immune system. So when you are subluxated, you have stress on your nervous system, and it is screwing up the communication in the armed forces, and it changes the immune system and how your immune system can respond. So now let's talk about allergies. So what do we commonly see when we check someone's spine who has allergies? Well, we commonly see some things. We commonly see that they have some of those subluxations or nerve irritations in the upper part of their neck or at the base of the skull and in their lower part of the neck here. So kind of right where like your neck and your upper back meet. I would love to say that there's always a cookie cutter recipe, but thousands and thousands of cases show us that there isn't a cookie cutter recipe, there just tends to be a correlation. This creates a chemical problem because this will affect the area in your body that creates histamine. Have you ever heard of an antihistamine? Well, you probably have if you've ever taken medication for allergies. Histamine creates an immune response associated with inflammation and mucus production. As a side note, most people walk around being severely dehydrated. That's why we talk about drinking enough water. Water is the strongest antihistamine. That's just one of the reasons why it's so important to make sure you're well hydrated. You should be drinking at least half of your body weight in ounces of water a day. Now let's talk about asthma. Has anyone noticed the trend with asthma? When I was a kid, I only knew a few kids that had asthma, and now you are seeing it more than ever. There is the allergy-induced asthmatic, the sports-induced asthmatic, the stress-induced asthmatic. So you're seeing puffers a lot. So what typically correlates clinically is C1 and C2, so right at the upper part of your neck, T1 through T5, so in the middle part of your back, or what I like to term for a lot of individuals and kids as that slouching area, and S2 to S4 on your tailbone. So the upper part of the neck, that is an area that will affect, once again, the brainstem, which is like mission control for our body. T5 through T9, which affects our adrenal glands, which create our stress hormones. So once again, it will affect that stress response. And S2 to S4, which often in little ones, you will see associated with bowels and poor bowel movements and constipation. And eczema. This is a picture of a mild case of it, and we are seeing this more and more often, especially in kids when their immune system is misbehaving. With eczema, we will typically see C3 to T3, so thyroid-related area, T9 through T12, so once again, adrenals, and S1 through S3, again, that's the bowels. So what happens a lot is the bowels aren't working properly. So there is a toxin backup, and that's why we see the toxins being, pushed through the bloodstream and then released through the skin as eczema. That's why when kids have their bowels cleared up and get them functioning better, that the eczema can clear up as a response to those toxins actually being able to be released. So what causes subluxations? Or those bones being misaligned, or those nerves being irritated? Well, it's life. Everyone gets that there can be car accidents and slips and falls, but really there's much more than that. We have an extremely unnatural lifestyle now. And you can probably see some of yourself here on these pictures. These postural toxicities that are things that cause those postural deformities and end up affecting our nervous system. So this is what we do. We correct subluxation through a three-legged stool of healing. Because I want to make one clear delineation here. We do not treat asthma or allergies or eczema. What we work to do is we just work to correct those subluxations to allow the nervous system to function better so the body can function better overall. Now we do this by performing these chiropractic adjustments in rhythm so that we can get the spine healing. We also talk about your bad habits that can be creating your subluxation patterns and the things to do to break those bad habits and break that pattern. Because our goal for you is to be healthy. And then exercise to strengthen the spine so that you can hold your adjustments better so your nervous system can function better longer. So if you'd be interested in learning more about how this can help, you specifically, or if you have any of these subluxations going on, you can call our office to schedule a free consultation today. Our phone number is listed there on the screen, 616-426-8500. But we're not quite done yet. So we want to take some time to look at some additional things that you can do to help unload that cup so that you can raise that threshold, overall for your body. Obviously we just talked about how chiropractic care and improving the function of your nervous system and therefore your immune system is really the initial building block for that. Because like we talked about, allergies are hypersensitivities of your immune system. And when your immune system functions better, it can decrease that hypersensitivity, right? If you decrease that hypersensitivity, then your allergies as a result will also decrease. But let's say your immune system was deficient from the start and you weren't breastfed as an infant. I know I wasn't. Or your child was born via C-section. What can you do to help supplement for what you missed out on? First, you can start by using probiotics. Probiotics are beneficial, good bacteria that can help improve your gut flora and therefore improve your immune system. Research has even shown that women who take probiotics during pregnancy significantly reduce their child's risk of developing allergies. If you don't want to take a probiotic in a supplement form, then you can also get probiotics through kombucha, fermented foods, kefir. But contrary to popular belief, regular store-bought yogurt like Dannon or Yoplait is not a good source of probiotics. You would have to eat like the whole Yoplait factory to get the probiotics that you would need from that yogurt. So please reach for one of those other sources if that is your goal to get. Also, essential oils. There are multiple essential oils that can be used to reduce inflammation, even inflammation in your sinuses. Diffusing eucalyptus oil can reduce inflammation in the sinuses, for example. You can also make an allergy trio roller and roll that on your cheeks, and that is made up of a combination of lavender, lemon, and peppermint oil mixed with a carrier oil. This can help to open up the sinuses and help to decrease the inflammation in them. Because once again, decrease inflammation, give you more space in that cup so that your body can handle more stress before once again it starts to flow over. Also, we're going to get back to diet. So really, you want to be eating a diet that's rich in anti-inflammatory foods and an alkaline diet. That will help to once again reduce the inflammation in your body and help you beat those allergies. So that means staying away from those white flours, the sugars, dairy, which does create a mucus response in our body, and processed foods, because these are all things that will create inflammation. And they will also feed the bad bacteria that your immune system is constantly working to fight off. And if your immune system is already working harder, that does not leave as much room for those allergens before your cup runs over and you are no longer in that subclinical level and you start to show symptoms. But eating a lot of green leafy vegetables, fruits, lemons, and drinking lemon water, and even eating lots of garlic, those are just a few things that can help to reduce that inflammation overall. Also, like we already talked about, drinking enough water can help to reduce the histamine reaction and therefore reduce those allergy symptoms that some people, may be experiencing. So you want to make sure that you are drinking enough good, clean water. And once again, that's half of your body weight in ounces of water a day. Also, another idea is eating 1 tablespoon a day of local raw honey. So you can eat it, you can put it in your tea. You can use it in a multitude of ways. This can help the body build tolerance to local pollen that could be running amok on your sinuses. So if you have any questions about, these ideas that we've given you of how to, get rid of those allergies or anything else that we've spoken about today, once again, feel free to contact our office at 616-426-8500 so that we can work to help you even further get rid of those allergies, get rid of your asthma, and help your body overall function better. Now, please join us next month as we talk about how to get 15 pounds healthier in 15 weeks as our next Body Signals workshop. Have a wonderful evening, and thanks again for joining us and making your health a priority.